Do you have neck or back pain? Seen a provider and told all you need to do is exercise? Have you tried to exercise only to find out that it does nothing for your pain or actually increases your pain? Don't worry, you're not alone. Hi, I'm Dr. Matthew Collins. I'm a chiropractor. I'm board certified in rehabilitation and fellowship trained in primary spine care. In addition to my training, education, and experience, I've been managing patients with neck and back pain for decades, and rehabilitation, physical therapy, corrective exercise, stretching has all been part of my arsenal of tools that I've used. Now, this is a two-part series. And the first part we discussed is exercise the primary source of treatment that one should use for neck or back pain. I recommend you go back and listen to that. I'll just give you the answer right now. If you haven't seen it, the answer is no. Now, please remember, these videos are for educational, informational purposes only. They do not replace medical or chiropractic advice. They're not a substitute for appropriate diagnosis or for treatment recommendations. Seeing the wrong provider can result in an incomplete diagnosis, poor treatment, and even worse, poor clinical outcomes, meaning like patients might continue to suffer for years. So if exercise is not the primary source of treatment that a person should use for neck or back pain, what should it be? Well, the answer is you can't really start with treatment until you arrive at a diagnosis. And I would really stress that for those that are watching this video. You need to have an accurate diagnosis in order to have an accurate treatment plan. And like I said before, the issue is in the tissue. If the doctor can't identify what tissue or tissues are painful, inflamed, dysfunctional, not working appropriately, damaged, injured, whatever it is, if they can't identify the actual tissues, then the likelihood of any type of treatment helping you is very low. Now, once the tissues have been identified, usually with the spine, exercise is a piece, a valuable part of the treatment plan, but it is not the place to begin. It's kind of like a relay race. You need to start with the appropriate first step, which is the diagnosis. Now, the research that we discussed in the last video talked about how exercise as the primary source of treatment did not produce good clinical results. There is other research out there to show what does work. There was research that was done on patients that had trigger points. Now, trigger points are painful hard nodules that develop in tissues. They develop over time, and they develop in response to underlying dysfunction or tissue damage. The researchers found that doing spinal manual therapy resulted in a near instantaneous reduction in the treatment, in the trigger points following the treatment. Now, there had to be repetitive treatment to change the tissues over time, but there was an instantaneous result. So for patients that come in that have hard, tight, tender muscles that feel like they need to be stretched, stretching sometimes doesn't help it. Going in there and doing manual therapy, like what a chiropractor can do, can reduce that. The mechanism behind that is called the brain connection. Now, we've also found from research that when a chiropractor delivers a high velocity, low amplitude adjustment, that's the typical chiropractic adjustment that you would see, the fast, quick one, sometimes where there's popping noises that occur in the joints, there is an electrical impulse that is generated from that does not get generated with low force exercise, that does not get generated with very low force mobilization or physical therapy, gentle joint rotations, even though there's a time and place for that. But the high speed adjustment to the joints sends a blast of electrical activity that impacts the surrounding muscles at that joint level, causing a near instantaneous relaxation, oftentimes of the trigger points like we were talking about, but it doesn't stop there. The electrical activity also travels up into the brain. There is an electrical signal that has been measured in research studies showing that even the cortex of the brain, different layers of the brain, the pain centers of the brain get changed as that electrical impulse goes all the way up there. There's research out there showing that points remote or distant to the level that was adjusted in the spine, even those points become less sensitive, according to what the researchers have found using their research techniques. So it's very, very possible and plausible to recommend to patients that have neck or back pain that they see a doctor first that can identify the tissue that is painful and dysfunctional to arrive at appropriate diagnosis rather than jumping straight into non-specific exercise therapy. Also, going in and relieving the joints, going in and relieving the restrictions that are in there that helps the joints move better, intuitively makes sense, because then as time goes on and as those joints improve the range of motion and maintain the range of motion, it becomes subsequently less painful to exercise and easier to exercise. So where does this bring us? It puts exercise into perspective. As somebody who is board certified in rehabilitation, I love exercise. I like it, but it has to be done at the appropriate time, the appropriate intensity, and in the appropriate way. You cannot take a non-specific diagnosis, such as a diagnosis of neck pain, which is not a diagnosis, it's just a symptom. But taking a non-specific diagnosis, giving it a non-specific exercise routine, and hoping for anything more than just non-specific results. You have many videos that you could have watched, and I'm grateful that you watched this one, and I'm thankful that you did. I wish you all the best on your healthcare journey. And until we meet again, be blessed and stay healthy.